There's another issue, the classic old one. Especially for companies with established varieties, in our line of work. Anyone who gets injections knows you can't run. Once you run, any demon or monster can run out, but old varieties are the same, they always do this. As long as it's an old variety, there will always be some historical issues that weren't clearly explained before. Now you need to explain it clearly. Let's see how the management measures are written. Enterprises need to solve historical problems. Before the implementation of the newly revised Drug Administration Law and the injection, the holder or manufacturer may change the original production process or other changes. Verify it, or approve it, or maybe you didn't report to the Drug Administration, but you only need to confirm it yourself. Verified and thoroughly researched. So after the new measures are implemented, you don't need to resubmit the change report. But the evidence must be kept safe. If it changes later, new requirements must be applied for the application. Let's look at the key timings. If it was before July 1, 2020, 202071, because July 1 is the implementation of the Drug Administration Law, get your OPI before July 1, 2020, 202071 OPI. Let's keep as much evidence as, but actually, what's more dangerous is that after July 1, 2020, 202071, according to the above change management measures, then you can't just say bygones are bygones. Therefore, related research and other related activities must be conducted according to current requirements. However, there is still a problem at the time zone level. My current requirements were not yet fully technical at that time. Although the drug management measures implemented on July 1, 2020, 202071, but the corresponding guiding principles are even more negative. So throughout this period, there will be a new guiding principle for me and an old guiding principle, conflict. And 2021 happened to mark this rather awkward period. So what about the historical issue here? We won't give a unified answer here, but I will say it is highly valued. Because this area is prone to conflict. Okay, then one more question. If some questions are asked incorrectly, how should you answer? Is this question a unanimous hard review? If your product is a generic, then this issue is not a problem. If yes, then no. But if my strain is not a generic, I have nothing to do with the unanimous hard evaluation. No matter if you fill in yes or no, it seems incorrect. If I were a researcher and then asked if I passed the unanimous evaluation, or I am a biological product, or a traditional Chinese medicine with the same name. So sometimes, if we don't add a scope to this issue, it can actually cause errors. It's like a classic question. Foreign lawyers often use the same things as those being. He asked the wrong question, but he had to say yes or no, third answer allowed. It's like when someone asks, "Does your mom know you're an idiot?" You must answer yes or no. But whether you answer yes or no, it still means there is no one else to answer this question, because its annual report is designed. It doesn't allow you to fill in a third answer. So how to fill it out, including other similar questions? This is the most typical example. I suggest everyone communicate internally. In some cases, even if they were in the same reach an agreement. We all choose this way. For example, if we all use the original, or we all fill in no, or whatever. Because this typical question isn't just about asking you to answer yes, behind it should be the corresponding follow-up actions by the Provincial Bureau. It needs to be monitored in key areas. We know that consistency evaluation, in particular, was set as early as this means that by the end of 2018, ordinary varieties must pass, and some special varieties. Special traces must be obtained before 2021. However, if not, it will not be re-registered. At the end of 2018, the scope was slightly if you haven't completed it, then if you want to register, this is equivalent to needing a special approval from the Provincial Bureau, which requires its approval. So, whether a product or a replica material has passed consistency, and the Provincial Bureau regarding this policy modeled after consistency evaluation. Its subsequent execution is closely related, but if you yourself shouldn't fall within this range. How should we fill it out? This is or rather, if some provinces can carry out some training. Here's a reference answer for everyone, which I think would be fantastic. Next, let's talk about the first year, because after all, we are the first year. The first year ago, I believe at the beginning no one could get 100 points, 100. It's impossible. So what was our bottom line in the first year, and what did we do at least? In my first year, I felt the fundamental purpose was to follow our annual The matter is being investigated by the Provincial Bureau. When the Provincial Bureau came to investigate, I think the first thing to look at was the situation. Your filling may not be perfect, but the holder must have a system for annual reports. Have you established this system? How did you implement it? This requires inspection, and it is clearly stated in the management regulations of the annual report. Surface. So, what does an annual reporting system mean by establishing it? Personally, I think it includes those parts. Is my system complete? Just like the 5 elders and the professional lighting department mentioned earlier, covers what needs to be covered, has functional division of labor covered all aspects? Are the corresponding documents complete? Including SOPs and other documents, are the corresponding records? If there really are defects, do I have a reasonable explanation for these flaws? One more thing to pay special attention to, have there been any falsifications in succession? I think I can tolerate other things, but the continuous. So personally, I think the issue of successive fraud deserves a separate discussion. I can have flaws, but if there is fraud, what consequences will there be? You can take a look at Article 124 of the Drug Administration Law. Those marked in red are all penalties. It targets the 6th item of this article, which involves fabricating. This is the first item. But if we look more broadly, as far as I remember, it was 2017. In 2019, the judicial interpretations of the 2 high courts were if a record is fabricated, it is considered fraudulent obtaining of production approvals. If you fraudulently obtain, it's written even more seriously here. We can see this from the current public consultation section of the cross-reg. The penalties will be even harsher than those above. And they will follow up with the legal representative and the supervisor responsible for the profession and other responsible personnel. So when we compare them, I often think there can be flaws. But no matter what, there is no bottom line to falsify anything. There's another point, which is even clearer. In any case, I cannot carry out because it's still Article 124, not as much as the 6th. Significant changes made during the drug manufacturing process without approval. Similarly, confiscation of production stoppages, business closures, fines, then the corresponding personnel are fined, blacklisted, detained, and so on. So these 2 items, one is fraud, the other in executing these 2 items during production without approval is absolutely I think this is also the most basic bottom line. Of course, there's another very important point. the negative remarks you just. This should be a relatively positive point, because the supervision of the Provincial Bureau also has corresponding responsibilities in its annual report management guidance was provided for the completion of annual reports. Therefore, in this regard, communicate more and seek advice more. And I think this is a good thing. If, after reporting enough information to the Provincial Bureau, it will also make it easier, because if it were just an isolated case, it would be, he might need to acquire a certain amount of information, and once he has a comprehensive grasp of the information, overall, the Provincial Bureau may be more bold or able to handle specific projects are provided with. So in this regard, if possible, it is still recommended to communicate more with them. At the same time, it is also worth requesting that the Provincial Bureau be urged to conduct a training, or a public declaration, would be even better. Why do people say it's frugal nowadays? After all, everyone first goes to their own province. Every province has its own Provincial Bureau's own mother. Each province's understanding and practice may differ from last year to this year regarding changes to product listings. Filing these requirements for negotiation really shows that each province has its own unique character, because each province solves its own problems in specific situations. His administrative foundation. Therefore, I believe that in each province, in subsequent annual report supervision, his understanding and practice are certain. This includes the combination of product changes, production licenses, and accommodation management. The new process is also different. These annual reports may be integrated with these processes in some way, so it should all be different, each province. It is especially important to note that when Chinese foreign holders import medicines, he said the designated domestic agent needs to become more familiar with the Provincial Bureau's requirements. Because from now on, annual reports will be handled by the Provincial Bureau. And it was inspected by the Provincial Bureau. The best approach was last year, when some provinces actually followed the external solicitation, or rather, the information issued by the National Bureau, another relatively new form for soliciting opinions, which has already led, and after filling it out, I also tried to get checked. With this foundation, this year will be better. It can be said that from last year to this year, the Provincial Bureau may have already gathered, because last year the National Bureau gave the Provincial Bureau around. Most of the content in that draft for public comment still matches the final version. It seems the difference isn't that big. Many questions can now be, because some of last year's practices and insights are now useful. Alright, for companies, we can only. It has a distinctly Chinese character, with many things built while feeling the stones to build a bridge. We can't cross the river by feeling the stones, we build bridges. It's like sailing a boat. I guess all I can do is say I'll set out first. Then, while drifting on the sea, I kept modifying it. Finally, by the end of August this year, when we finish our annual report, when it's time to submit, my system might only sync at this time. Synchronization is basically in place. This might be a situation everyone will face in the next 2 months. It's not something you think of before you act, you think as you go. Because in the worst case, as long as you just start over, refill it. After all, at present, whether it's companies or regulators, none of us had any experience. Finally, let's talk about the report and changes within the report. Because I really haven't had much time for this, it's been part of the overall structural reflection of the annual report. Actually, changes within the report are less important. Before discussing the changes mentioned before, let's talk about the required. In fact, it is the required change management system. We should be familiar with Article 4 of the change management measures mentioned. For the fourth point, I highlighted the key points and marked 1, 2, 3, 4, 5, 6, 7, 8. 1. In fact, the fourth article was cut down as a task. That is, which departments within our company, Who should be responsible for what? On the right, I set up a fingerprint sensor, which is actually a reference. Because every company is different. If our company has registration, production, and quality, these three representative things, the evaluation of the change control system guiding principle, the internal change classification principle means that which departments have high relevance, which are less relevant, which matters should be divided, and how to divide responsibilities. There should be a holistic consideration to ultimately create a complete one. If the regulators only set the fourth point, the men and women who say it word by word, what has our company done, and whether we have achieved it? 2. Whether it has been achieved. At this point, our relevant departments have already established all these things, and there is a written, documented document that can be provided. Overall, I think this is a regulatory. The system required by regulators. With this system in place, the specific operational steps become quite important. When we specifically evaluate this change, there is inevitably some awkwardness. This has been mentioned before. There will be a relationship between current guiding principles and previous guidelines. We know that the above guidelines for pharmaceutical changes for chemical drugs were issued on. Then, 2 months later, the Chinese medicine was released, and after another 2 months, the guideline, then it was only released. Their previous guiding principles were quite different. Chemistry and Chinese medicine are pretty close. Back in 2017, I wrote a version, 2017, and that version was pretty well written. If you compare it to the previous one, there has been significant improvement, so its reference value is relative, but biological healing is a different story. Currently, the version released on June 25. Personally, I'm quite satisfied with it. It's really well written, but the previous version was already very unreliable. Before the 2021 guidelines, there was only one edition written in 2005, 2021, 2000. Including the cover, there are only 5 pages in total, and with the cover at dusk. It is very difficult to reference or execute. In this situation, in the awkward year of 2021, this is a case that spans both the old and new guidelines. In our evaluation, I think the most basic thing is to take a look at it. If I have changes that occur before the new guidelines are released, have I conducted the evaluation according to the old guidelines? Whether it meets the requirements of the old guiding principles. I think if it doesn't fully meet, but where is the rationality for me? Because the reason the National Bureau is reformulating and issuing new guidelines. It's because the original guidelines were unreasonable. So I don't think I have to be like him. Especially since I just mentioned the biological product one, which is too, even we regulators themselves don't use it. Everyone dislikes it, it's not easy to use, but if we ourselves do not follow the old guide, at that time, the new director hadn't released the original version yet. How did we assess it? This change. I think this needs to be supported by documentation. Another point is that changes actually need to be recorded. This is related to changes to my report, and whether it's an approval or approval type, it doesn't matter. Whether major, medium, or minor, it should be recorded. Should all be traceable. If we look at the change control system and classification principles, change the camera list, change risk management, research and evaluation. Verification. These 3 should be considered for future research or evaluation. or verify. Because not all changes need to be verified, but they all need to be evaluated. And after I changed, when I implemented it, how was it allowed to pass? Because it defines the actual occurrence of change and when. I think this information, within our system, everything should be documented and traceable. Also, as mentioned earlier, especially for domestically produced medicines. Because after the above and change management measures for drugs were issued, the country has taken a major step. At the provincial bureau level, in fact, the filing of production license for the medium change items, it's a 2-in-1 item. As for registration and filing matters, because of the above change, a one-size-fits-all approach was forcibly changed, changing the locations for all of them were turned into filing categories. But in fact, its technical considerations may be significant. So this leads to a provincial bureau combining production licensing. It has had to develop more safeguard measures. For example, the provincial bureau should initiate some technical standards to ensure compliance. It is technically controllable. In this case, each province has its own process operations, including implementation, some requirements, data requirements, and so on. They're all different. We are considering changes to our report. If the provincial bureau refuses to recognize it, it even went so far as national resolutions not under the provincial bureau's response. When making changes to the entire report, we must take into account the province. What are the requirements for filing related documents? If you have doubts or are uncertain about changing the category, to communicate with the provincial bureau accordingly, and how feasible is the communication, whether it's absolutely necessary, we need to confirm with the provincial bureau that my change. Did you do it? What was the situation? If I hadn't done it, I should have prepared one. Why do I think there's no need to communicate with the provincial bureau? I can immediately confirm that all these aspects are actually related to the provincial bureau. Finally, I think this is also a new problem we face now. Just treat my childbirth as a matter of encounter or commission. Things will get even more complicated. So the new regulations should also be reformed, which is a benefit of opening up. Finally, we can unbind holding and production. Then the holder may not produce it himself, or whether he produces it, he can commission production. But now a problem arises. I also discuss my entire requirements, change control, internal changes. Change item list, these may not be a problem for our free factories. But with the entrusted factory, the owner doesn't really know. Or maybe these things happen at the contract manufacturing site. How did this happen? Or how to be sure? Or, when the provincial bureau came to inspect, they asked about what is its change control system like? Can you show me the list of change items? At this point, can the holder be able to take it out? I think this might only be the case after our holder reforms. A new question will pop up. Because our Lienbao management regulations clearly state, if there is a situation of contract production, the holder shall report to the holder's province for joint reporting. If the production site is not in this province, then in this situation, how do holders report it? How can the holder be sure you can answer all the provincial bureau's questions? It took half an hour, and I finished explaining everything I had prepared on time to everyone. Right now, I'm following the host's instructions. We can have an interactive session where I can look at everyone's questions. I can't just answer directly, so maybe I'll discuss it with everyone. Thank you. Teacher, I posted my question in the group. You can see it, right? All right. These are community questions and that's it. Let me take a look first, because the previous update, for example, involved very specific inactivation processes and so on. Do they count as annual reports? I feel that from my side, I would do this myself. I will first check whether the guiding principles we issued in 2021 clearly explain this 2021 matters. If our latest Chinese guiding principles do not cover it, I will look at those that might be similar to it, even though our guidelines don't specify this change. Furthermore, as some friends asked, it involves some inactivation processes, or the shortcut level of the production area. I look at things that might be similar to it. I believe risk resulting in similar changes. What does this count as in our guiding principles? On this basis, if I have the ability, I will compare the US and EU. Take a look. Because you don't need to look at WHO's products, who only produces biological products, who. And for our Chinese company, on June 25 last year, we wrote about biological products and the original guidance, so the WHO reference is still quite extensive. After reading all these things, I felt myself probably a judgment. When soliciting opinions on management regulations, I remember it wrote that line. If it is not included in the guidelines, it can be omitted. But now we can see that when the final release was made, that phrase was, because this statement may not be accurate, because no one can write the whole situation. I think in this regard, it's best to evaluate it yourself first. Assess it yourself. I think asking the Provincial Bureau should be the way I feel confident. After our company evaluates it, we believe it should be considered a small matter. But I wasn't at ease. I was indeed afraid that after I finished my assessment, the Provincial Bureau might not agree. I have carried it all out. So should the product be withdrawn? Should we recall them? What penalties are involved? At that point, go to the Provincial Bureau and confirm according to the communication procedures issued by the Provincial Bureau. I think this is the only way it can be. This is a typical issue, especially on the reporting side. Then you go and confirm. There are also some colleagues involved in overseas production. Overseas production must be reported. And as I just said, I think I should be answering this question. As for the corresponding commitment letters and authorization, who approves it, including whether notarization is required, and so on, you'll notice that it's not clearly explained yet. Without making it clear, at least I would think. The person in charge of the enterprise, either of these two is actually represented. From the perspective of company law and legal affairs, all are okay. Okay. As mentioned earlier, if the medicine is imported, for drugs produced overseas, we can imagine the entire, all responsibilities. The corresponding signatures are all signed by this agent, just do it, and that's it. Okay. Then a particularly typical question arises, which is, our previous varieties, whether imported or domestic? A problem always arises. At that time, China also did not implement the public interest information form. Nor did they follow manufacturing verification. In the state-approved public welfare and standards, the specific. In fact, in my registration and application materials, I never mentioned it from start to finish. So what should we do? Personally, I believe that under no circumstances should you fill. That is to say, I cannot live without a production line. Right now, I think this is exactly the time for a census. I used to receive some goods, so now I will fill in my true, current, and accurate information about them. At the same time, I will keep a record to prove that I've always been giving birth there. I haven't changed. Or rather, I changed in a certain year and month, but at that time, not under the new system. Because we will know before the new drug registration management measures are promulgated. In fact, in many changes to social venue production lines, registration is not submitted at all. At that time, it might have just been registered and reported at the Provincial Safety Supervision Office. That's it, it doesn't require registration. In this case, we just need to leave the evidence and the corresponding. But personally, I strongly disapprove of filling it out. Because the specific production workshop and production line where this ambassador resides, whether in our annual report or when we resubmit the medication. When re-registering or submitting any significant pharmaceutical, regulators may be required to supplement this information. If you have not filled out the public information registration form before, you have to write it out of necessity. If you previously knew that something was not specified in the summary, you have to write it out of force. I feel this is unavoidable. A listing risk management plan is a good question. How do you write it? There is no standard answer, because the state does not provide it. Our country is currently reviewing registration documents. In our Module 1, there are requirements. On the other hand, in the quality management standards for pharmacovigilance, in terms of risk management itself, but the risk management plan we mentioned in the annual report, it's different from the other two. Because our post-listing risk management plan was not submitted to me when we submitted risk management plan coordination. Actually, there is a gap on the Hong Kong side, which I now feel is a shortcoming. Nor does it mean it is equivalent to a pharmacovigilance risk management. That's all I can say. Because from the Hong Kong side, this management plan is considered. The risk management plan referred to in pharmacovigilance is implemented at what happens if adverse reactions occur after eating. The medicine has already left the factory. And often, when we talk about risk management plans in annual report, it may refer to the fact that before the medicine is sold. During my production process, during the accusation process, I consider what risks it carries. How should I reduce it? There is no standard answer, but I think on a larger scale. According to GMP, China actually includes some design details, GMP. Then, in the corresponding SH guidelines, there are some conceptual design elements, SH. I can only refer to this when writing. As for the specific writing, I personally feel this should be referenced by the quality principle. Basically, I just say, I identify the risks. See if there are ways to evaluate it, what tools I use. What metrics are used to evaluate it, and after evaluation, how do I manage it? How do I take follow-up actions? It is nothing more than this. The entire set of principles is consistent with the GDP risk principle, GVP. It's just that the areas it covers may be different. But honestly, I couldn't answer how to write it, there was no answer. As mentioned earlier, the review of imported drugs is not under the jurisdiction of the National Bureau. It should be clear that the Provincial Bureau is responsible. That's why I emphasize that domestic agents producing drugs abroad should be more attentive. The Provincial Bureau should communicate. Perhaps both sides need to go through an adjustment process. The Provincial Bureau suddenly started supervising so many imported drugs. Perhaps a lot of information was something I hadn't encountered before. So for France, as an agent, it's the same. In the past, we were more accustomed to communicating at the National Bureau level. Nowadays, much of the information in the Lienbao must be coordinated with the Provincial Bureau, and you also need to adapt. Then the active pharmaceutical ingredient is not. Active pharmaceutical ingredients are not included in this joint report. Because we know about APIs, registered APIs have a source on our annual report on counseling registration. We've been doing this for several years now. That's another system, the registration platform system, where you can report. Therefore, the APIs set later should not be applicable. That really is. For those already approved last year, those approved last year don't need to be reported this year, because as mentioned just last year, it still hasn't completed its weekly tax. So after waiting for a full week of taxes, next year, it will be integrated into the 2022 fiscal year but actually, if you insist on reporting, I believe the regulators won't stop you. The syntax covers all approval numbers and products. Now, if we look at the exported data, we can clues. First, everyone had to tie up each candied hawthorn. Each candied hawthorn has a document number, an approval number, but if it involves repackaging, there will be some differences. Because last year, we happened to encounter packaging separation, shifting from an approval, so in the first half of last year or earlier, it will have some previously approved subpackage approvals. In this case, it will have an approval number. Should this approval number be? There are no standard answers to these questions. I think on one hand, you can ask the Provincial Bureau, but on the other hand, if we fill out the joint reporting system, it will indicate whether the product is packaged separately. If you choose yes, you'll notice an extension option appears. So for products with separate packaging, the document, or is it me? Wait for it to select which option to expand later. I selected the corresponding document number or filing number in it. Before obtaining the standard answer from the Provincial or National Bureau, I think companies can fill in the form according to their own preferences first. Even if you fill in the wrong one, for example, previously, the National or Provincial Bureau asked whether you could fill it up. You didn't do it, but you have already submitted it. It wouldn't be considered a defect, right? Then you can make corrections afterward. I don't think this is a major issue. The proxy for the power of attorney is still uncertain, because the overseas internal agency authorization letter, because how many responsibilities must the domestic agent undertake? We don't know now. I can't write everything. So from my side, I would suggest we issue only one document. This is the authorization of the annual reports function. And this authorization hasn't been registered with the Provincial Bureau yet. So far, nothing has been said about it. When I feel that whether it's the Drug Administration law, the draft for public comment is still the domestic agent under administrative management that you. From the draft for public comment, it seems that all of them are aimed at filing with the Provincial Bureau. Go. So let's take a look first, and the relevant regulations determine that filing with the provincial, our agent will then file with the provincial bureau. Changes are not just about reporting pharmaceutical changes, they never said that. So I believe that whether it's pharmaceutical or changes to the instruction manual, should all be included. After all, apart from what I just mentioned, I only introduced the pharmacy changes. But we will find that on February 10th last year, 210. Clinical changes in chemical pharmaceutical biological products and chemical biological products. This principle also led to what it called clinical changes. This refers to changes to the manual, which should be referenced. The guidelines clearly specify which changes require approval, which are filed, and the very few cases are reported. I think that guiding principle is very clear, everyone can refer to it. Currency has not resumed production. If production hasn't resumed, if there is no production at all, so there are no suppliers, only suppliers. Personally, I feel the supplier prescription should be for the last time I have been in use. That is, during the final validity period of my certificate. Including a registration system, especially at the provincial bureau, it is like reviewing yours. So what was before? I filled in according to the I think there shouldn't be any problem. Let me see, the client applied late. Since it's aimed at the US and EU, I won't answer that now, because it has nothing to do with today's topic. If there's a chance, we'll do hosts have more questions? Alright, that's enough. That's all for the questions. Thank you, teacher. Okay. Thank you very much to Teacher Wu for his wonderful sharing. Everyone can especially teacher. If you're interested, you can also follow our Teacher Wu public account, Ring. Xing's painting style is quite unique. It also provides more inspiration for those of you. Don't have to leave, but there's still a lottery soon.